Hi, I'm Dr. Parijat Kumar, founder of International Sports and Orthopedic Manual Therapy. I hope you enjoyed our today's virtual lab on manipulation and mobilization techniques of all the joints and evidence-based approach. Me and Dr. TJ, we went all over the joints and we tried to help to manipulate the joints, which can help the patient's symptoms and signs to to be fixed in like few days or few sessions. All right, so welcome to our quiz answers today, guys. Post lab quiz answers. Let's get started. The quiz was a bit difficult, I understand, but believe me, when you have to perform the manipulations, you have to know all those clinical prediction rules and the criteria. So welcome to the post lab quiz answers. Let's get started. The first question was, which of the following is not the part of the lumbar manipulation CPR? CPR is the clinical prediction rule. So you need to know all these clinical prediction rule when you're performing these manipulation or any kind of a treatment or assessment techniques. So the options were five, but the correct answer, which is not the part of the CPR, is duration of current episode should be more than 16 days. It should be actually less than 16 days. So that is the lumbar manipulation CPR, that duration of current episode should be less than 60 days. But the answer to this question was the first option, duration of current episode more than 16 days. All right. Coming on to the next question, second question, which of the following is not the part of cervical spine CPR clinical prediction rule by Petendra et al? That he really did some researches on cervical manipulations and cervical spine and the clinical prediction rule. So the correct answer to this is the fourth option, which is the stiffness with postero-anterior spring testing of middle cervical spine. So that is not the part of the CPR by Pretendera et al. Okay, fourth option is the correct answer. Next question, which of the following is not the neurological effect of manipulation? So when you're performing the manipulations, you should be knowing the contraindications, precautions, the physiological effects, as there are patients who can ask you those smart questions. So that's why we formulated this lab and quiz in a way where you can actually get yourself educated and then further educate your patients. So the question was, which of the following is not the neurological effect of manipulation? The correct answer is the first option, activation of type 1 receptors. It does not activate type 1 receptors. It does increase the activity of proprioceptors, adjustment of the nociceptor receptors. It reduces the central sensitization. There are researches for reducing the central sensitization through manipulation, and it has a lot of effects on autonomic nervous system, especially the sympathetic and the parasympathetic. So the first option is not a neurological effect of manipulation, activation of type 1 receptors. All right. Coming on to the next question, which of the following is not the contraindication of manipulation? And as I said, you need to be knowing all the contraindications, precautions, absolute and relative there for when performing the manipulations. Again, we are asking not the contraindication. So always, guys, please read the questions carefully. And the fourth option is the correct answer. Severe mechanical pain is not the contraindication of manipulation. So fourth option is the correct answer. All right. Next question, fifth question, which of the following is the contraindication for the manipulation? So we are asking the contraindication for manipulation in this question. And obviously, when the patient comes to you with a multiple root nerve pathology or there are multiple nerve pains, that is an absolute contraindication for manipulation. The other options can be a relative contraindication, or you can be performing the manipulation at the other areas, but absolute one is the multiple nerve root pathology and absolute contraindication for manipulation. All right, which does not come in, which you might have read in the CPR, the clinical prediction rule as well. Next question, the sixth question, which of the following is not the indication for superior tibiofibular manipulation? So when you're manipulating the superior tibiofibular joint around the knee joint, which of the following is not the indication? TFL hypertonicity is an indication. restriction in the terminal knee extension. I myself have seen when I perform the superior tibial fibular manipulation, the knee extension increases. Iliopatellar syndrome or the runner syndrome, it is the first option. Medial knee pain is not the indication of superior tibial fibular manipulation. So the correct answer is number one, medial knee pain. Coming on to the next question, guys. What level will you manipulate to improve the upper extremity symptoms via sympathetic downregulation? As we said that there are many neurological, physiological manifestations of manipulation as well. So there is sympathetic downregulation when you perform the manipulation on the spine in your hands as well. So that's what we are asking about the upper extremity symptoms. C6, C8, S2 to S4, T1 to T6, T7 to T12. And the correct answer is T1 to T6. I hope nobody did this S2 to S4 because that's really down. That's your micturition reflex. So the upper extremity symptoms will be sympathetically downregulated by manipulating T1 to T6 segments. The third option is the correct answer. Coming on to the next question. What percentage of extension or wrist extension is contributed by scaphoid motion according to Kaufman et al.? Kaufman et al. Has done a lot of researches on scaphoid motions related with the wrist movements. And believe me, he has shown 92% of wrist extension is contributed by scaphoid motion. So the correct answer is the fourth option, 92%. Coming on to the next question, guys. What manipulation technique will you use to improve the hind foot eversion? So my inversion or eversion. So if I want to increase the hind foot eversion, it's very simple. If you have attended our ankle or foot lab, and we will be doing courses on these joints as well. So hind foot eversion will be increased by a supine subtalar whip, and I myself showed those whip manipulation and subtalar manipulation in order to increase the hind foot eversion, and that's very much required for a shock absorption during the gait cycle and the mid stance. You really need a good hind foot eversion for mid stance or gait cycle. So a supine subtalar whip will be required to do a hind foot eversion improvement. All right. Coming on to the quiz, last question, and the next would be the bonus question. So which of the following is not an indication of cuboid manipulation? If you know your anatomy first, cuboid is the lateralmost bone of the foot. So obviously to improve my lateral foot pain, I would do a cuboid manipulation, because the question asked is not an indication. I would also do cuboid manipulation to improve the superior and the inferior tibiofibular dysfunction, to improve the midfoot mobility because it's present in the midfoot and the hindfoot area, to improve the pronation. No, that's the correct answer. To improve the pronation, that's not an indication of cuboid, because cuboid has nothing to do with the pronation. So correct answer is the fourth option. To improve pronation is not an indication of cuboid manipulation. All right, guys. Now coming to our bonus question, and guess what? We really didn't include the pelvis question this time. Our lumbar spine question, the bonus question are based on a lumbar spine. So the question says, how will you explain the right side bending of L3, L4 on the left-sided facet of L3, L4? So this is an orthokinematics question of lumbar spine, and the correct answer to this is option one, movement of L3 up and forward on the left. So please make sure when you are diagnosing a patient and when they're complaining of pain in the side bending or a side flexion, and just ask your patient to pinpoint the exact area where it is pinching or causing you the discomfort. And that will help you to recognize the segments of painful movements. So if you don't know the orthokinematics, then you cannot be telling whether it's a L3 or a L4. So if you know the orthokinematics where the movement of L3 is going up and forward on L4 on the left side, which is the correct answer to this question, then only you can properly know which side would be painful and which side you have to manipulate and work on. So that's why biomechanics, arthrokinematics of all the spine is important. Before you go and manipulate, please be very thorough with your basics, your biomechanics, and your arthrokinematics. Last bonus question is, how will you explain the pain with extension, right side bending, and left rotation on L4, L5? I just saw a young girl. She's a spin bowler in cricket. She plays cricket and she's a young spin bowler. And this was the exact case. She was having pain with a slight extension, not much. She was having pain with the right side bending and left rotation on L4, L5. And that really alarms me that that is a facet impingement of L4, L5. It's not going to be the opening or closing restrictions, which you generally have on lumbar spine. All right. So the correct answer to the bonus question was L4, L5 facet joint impingement. All right. So that was all for the quiz answers, guys. I hope you enjoyed our quiz and our virtual lab on manipulation and mobilization techniques for all the joints. It was an evidence-based approach, so you need to know your clinical prediction rules, your biomechanics, your orthokinematics, your basics anatomy and the physiology. If there is any feedback, you can email us at isorehab@gmail.com, or you can let us know uh, through the feedback section. Uh, we welcome your feedback. I hope you enjoyed today's lab. Uh, our next course, ISOMT certification course, will be actually done on lumbar spine. This will be done on November 21st and 22nd, which is Saturday and Sunday from morning 10 a.m. till 1 p.m. Indian Standard Time. So don't forget to register for a certification course for lumbar spine, because when you are treating lumbar and pelvis or the low back pain, it's very important. So please register for lumbar spine certification course, and we hope we can help you improve the quality of the healthcare. This is Dr. Parijat Kumar, founder director of International Sports and Orthopedic Manual Therapy. Keep learning, keep improving lives. Thank you.